Antidiuretic hormone, or ADH, is also called vasopressin. It's a hormone that acts to control excessive urination. It causes water retention and constricts blood vessels, which means it also helps to increase blood pressure. The brain has two interconnected structures, the hypothalamus and the pituitary gland. These two structures are connected by the pituitary stalk. The hypothalamus is a small part of the brain above the pituitary that contains several groups of nerve cells. Two of these groups make and secrete ADH. When ADH is produced, it travels down nerve fibers to the posterior or back lobes of the pituitary. When there is less blood volume in your vessels and your blood pressure is low, the blood becomes more concentrated. This happens when you're deprived of water or are dehydrated or have a lot of bleeding from surgery or an injury. Sensors in the heart and neck blood vessels send a signal to the hypothalamus and pituitary to increase the secretion and release of ADH. ADH has two actions, one on the kidneys and the other on the muscles around blood vessels. First, ADH instructs the kidneys to soak up water to keep the correct amount of water in the blood vessels, bringing the concentration in the blood back to normal. And second, ADH acts on smooth muscle cells in the arteries, causing them to constrict, which increases the blood pressure. Surgery to remove a pituitary tumor causes the posterior pituitary to be manipulated, and ADH is either excreted in excess or inadequate amounts. When ADH is excreted in excess, it is called syndrome of inappropriate antidiuretic hormone, or SIADH. So in a person with SIADH, there is an excess amount of antidiuretic hormone, which causes kidneys to retain too much water. With too much water retention, the levels of sodium in the blood become diluted and low. And the symptoms of syndrome of inappropriate antidiuretic hormone can include decreased thirst, decreased urination, which is dark yellow, swelling in hands, feet, and ankles, and lastly, confusion and seizures may occur if sodium is very low. Now, if ADH is excreted in inadequate amounts, it is called diabetes insipidus. Diabetes means to pass through, and insipidus means lacking. In this case, the urine is lacking in color and is clear. Diabetes insipidus may occur if there is disruption or damage to the pituitary stalk from a head injury, tumor or swelling around the posterior pituitary, or after pituitary surgery. ADH secretion is inadequate in diabetes insipidus. When ADH secretion is inadequate or low, the kidneys fail to receive the signal to retain water, and large amounts of dilute, almost clear urine result. Excessive urination, which occurs as a result of low water retention in the kidneys, causes extreme water loss in the body. And the extreme water loss can lead to hypernatremia, a condition in which the sodium concentration of the serum in the blood becomes very high due to low water retention. And the symptoms of diabetes insipidus can include severe thirst, despite constantly drinking water, dry mouth, lips, and skin, frequent urination, particularly at night, weakness, fatigue, loss of appetite, and cramping. So, how is SIADH treated? SIADH may occur up to 2 weeks postoperatively. Blood is usually drawn several days after hospital discharge to monitor sodium levels. In a person with SIADH, there is a lot of water in the body and the sodium levels are low. Therefore, the main goal of SIADH therapy is to get rid of excess fluid in the body and to bring the sodium level back to normal. In order to reduce the fluid level in the body, patients' water and fluid intake are limited. And in order to bring back sodium levels to normal, salt, or sodium chloride, may be given by mouth in food or in the form of intravenous fluid if sodium is very low. Now, for the treatment of diabetes insipidus. In diabetes insipidus, too much fluid is excreted from the body, and thus the serum sodium level becomes high. So, an assessment of blood sodium level, blood and urine concentration, or an osmolality test may be needed for diagnosis. And treatment is to administer vasopressin or desmopressin, usually either as a nasal spray or by mouth in a tablet form. Post-surgical SIADH and diabetes insipidus usually resolves itself quickly after surgery, but in rare cases, lifelong medication is needed. Any changes in your normal thirst and urination should be reported to your medical team